Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hi, this is part 2 of a podcast entitled Heart Failure is Scary, but It Can Be Helped. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. I want to thank you for tuning into today's Invite Health podcast. You can find all of our episodes for free wherever you listen, or visit invitehealth.com/podcast. Please subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. The info on this episode is linked at the episode description, so let's get going. So in part 1 of this podcast, in the first episode, I discussed the symptoms of heart failure, what increases your risk, what you can expect from it. I didn't go into the medication. I'll do that either at the end of this episode or I'll do a third episode for this podcast. But today I want to cover supplements. I did cover them briefly. I covered some supplements during the first episode. Now let's go into it. Let's roll up our sleeves and really go into the nutrition for heart failure. This is a report from the Federal University of Pernambuco down in Brazil, but it's very interesting because it has to do with vitamin D. It's published in the journal ESC Heart Failure. And we know that vitamin D is important for strength and muscle function. It's not just for bone health. And there's a lot of studies showing that. There's a lot of studies showing that you need vitamin D for stronger leg muscles and stronger arm muscles. And there's been several studies that show that older people who lack vitamin D, they're more likely to have weakness in their legs and fall. Well, your heart is a super high function muscle. So if vitamin D is needed for your other muscles, obviously it's going to be needed for your heart muscle. And according to this study, the risk of heart failure was more than 12 times higher in older people who lacked vitamin D. But here's the thing. Their base level for lacking vitamin D was higher than the accepted level. Typically, vitamin D deficiency is below 20 or below. That would be nanograms per milliliter. In this study, it was 30 or below. And they're not the only ones that use a cutoff of 30. So lacking vitamin D is bad for all muscles, and your heart is a muscle that is pumping pretty much once every 3/4 of a second, pretty much 80 times a minute, over 100,000 times a day. It requires vitamin D. So that's the first study, and it doesn't hurt to take a vitamin D supplement. You're never going to get enough vitamin D from your food. It's not happening. Even when they fortify dairy, you get like 100 units of vitamin D. So a little conversation here on vitamin D. Young people with healthy skin can make plenty of vitamin D in about 15 to 20 minutes. If they get 15 or 20 minutes of sun every day, they'll make sufficient vitamin D. However, if you have darker skin, it becomes harder. If you use a sunscreen, obviously it's not happening. If you're wearing a lot of clothing and covering up, obviously it's not happening. But also if you have older skin, it's not that successful at creating vitamin D anymore. It becomes less efficient. Now, beyond making vitamin D, let's discuss that. The sun, the ultraviolet rays of the sun, hits cholesterol in your skin and creates a precursor to vitamin D. 25-hydroxycholecalciferol. That is stored in your liver. But that's not yet active. That's not going to be good yet for your muscles and your bones and your heart. It has to be released, which is released in a very controlled fashion. It goes to your kidneys, and the kidneys activate it. And you need magnesium to activate vitamin D, so keep that in mind. You have to eat enough vitamin, you have to get enough vitamin D, and you have to have enough magnesium-rich foods in your diet, which can include things like green leafy vegetables and fish. They have magnesium in them. Unfortunately, about 70% of Americans lack magnesium in their diet. So for a lot of people, taking a magnesium supplement goes hand in hand when taking a vitamin D supplement. But in any event, let's get back to vitamin D. When a doctor checks your blood for vitamin D, it's not yet the active form. So we still don't know how much has been activated unless the doctor does a second test to look at that. The active form that comes out of the kidneys, that's good for your muscles, good for your heart, good for your bones, is called 1,25-dihydroxycholecalciferol. So it won't hurt to take a vitamin D supplement. There's very few people who should not have one. For instance, a certain autoimmune disease, mixed connective tissue disease, they may not, I don't know if it's good for them or bad for them to take vitamin D. They haven't really done the research on that because it's a collagen disease. Another disease which may preclude you from taking vitamin D could be a problem with your parathyroid gland. Your parathyroid, it's near the thyroid, near the thyroid. It has nothing really to do with the thyroid. This gland, it looks like 4 little grains of rice, has everything to do with controlling calcium levels in your blood. And when there's inflammation or a disease of your parathyroid glands, you could retain too much calcium. Now the problem is vitamin D also, besides helping you absorb calcium, also helps you keep calcium in the body. So it's quite possible that people with parathyroid disease have to avoid taking vitamin D supplements. But that's like 2 rare conditions that really affects just a very small percentage of the population, a tiny percentage of the population. So for the lion's share of people, taking a vitamin D supplement is really indicated. And I prefer vitamin D3 over vitamin D2. The research shows it works better and it has longer lasting benefits than vitamin D2. So now let's keep on going. So it looks like vitamin D may help prevent heart failure. So we're looking at things that can help prevent heart failure. Fish oils. According to a meta-analysis, fish oils may help reduce the risk of developing heart failure by 15%. Now, heart failure is fairly common. So this is the journal Clinical Nutrition. It's Harvard University and Brigham and Women's Hospital. Brigham and Women's Hospital frequently works with Harvard University. They're both up in Boston. 7 prospective studies, data on 176,000 plus people, of which 5,500 developed heart failure. People with the highest level of EPA and DHA in their blood had a 14% lower risk of heart failure compared to people with the lowest levels. So what's that all about? When you eat fish or take fish oils, there are other oils that could be in there, but the 2 they look at are EPA and DHA. And these oils are very important for your muscles and your heart's a muscle. Of course, they always talk about it for your brain health and your vision and your heart health, and possibly women's breast health and bone health, believe it or not, and joint health, joint pain. But because fish oils seem to help with arthritis. However, with muscle, fish oils are really important. There's a number of studies that show in older people with sufficient fish oil levels in their blood, they tend to lose less muscle with age. They tend to lose less strength. It helps them hold on to their strength and their muscle. Well, your heart is a very important muscle. And fish oils are known to lower inflammation in the heart, but they also seem to help lower the risk of developing heart failure. They're very good for the heart. They lower the risk of sudden cardiac death. God forbid you had a heart attack. If there's sufficient fish oils in the blood, they're in the heart, that means there's less damage to the heart. But in this case, they found that fish oils were connected to a 14% lower risk of heart failure. Now, mind you, they looked at the level in the blood. That's an important distinguishing point. Normally, in studies, they say, well, how much fish do you eat? Or do you take a fish oil capsule? But they don't check the level in the blood. And this is more powerful evidence because they actually saw when you have this good amount of fish oils in your blood, by the way, that's called the omega-3 index. You can actually have a blood test to tell your omega-3 index. When you have this amount of fish oils in your blood, well, that's enough to really help protect your heart. Now let's talk about a supplement near and dear to my heart. There's heart attacks in my family. I take it every day. It's called ubiquinol. It's unbelievably important for energy production, to clean the free radicals out of your cells, but also for your heart. So let's talk about a nutrient that was discovered back in the start of the 20th century. It's called coenzyme Q10. a lot of information was developed in Texas. A lot of work was done in the 1950s, 60s, and 70s in the state of Texas. They have labs for studying CoQ10. And they found out that CoQ10 is found in many organisms. In people, it's so important. And it's really important for energy production in general and preventing or treating fatigue, muscle function, and of course, your most important muscle is your heart. It's very important for heart function. And there's been many, many, many human clinical trials that coenzyme Q10 is good for the heart. Many, many, many human clinical trials. So here's the American Journal of Clinical Nutrition. It's Tulane University, which would be in New Orleans. It's a randomized human clinical trial. Actually, it's a review of randomized human clinical trials. Coenzyme Q10 improves heart function in people with congestive heart failure. So it improved the left ventricular ejection fraction, the amount of blood the heart can actually pump, something that declines when you have heart failure. And then you could get that oxygen-rich blood out to all the body, which makes it easier to breathe, which makes it easier to move the blood around, which makes it, of course, you have more energy. So it's helping with a lot of the symptoms of heart failure. Now, here's the thing we've learned. Coenzyme Q10 has to be converted into its active form, ubiquinol, before it works. The term coenzyme Q10 is actually an umbrella term for different forms of coenzyme Q10. The one that most companies sell is called ubiquinone. It's not active. It does nothing. And it can't do anything unless you convert it to ubiquinol. It turns out as we age, it gets harder and harder to convert coenzyme Q10 into the active form called ubiquinol. Some people pronounce it ubiquinol. I'm happy either way. Nobody's decided there's the proper way to pronounce it. But in any event, ubiquinol, which is the way I pronounce it, and if you want to say ubiquinol, fine. Ubiquinol has to be, the CoQ10 has to be activated into ubiquinol. At the age of 40, we start to lose that ability at about a rate of 1% per year, which doesn't really mean anything. So by the time you're 49, you've lost about 10% of the body's ubiquinol because you're not as efficient at converting regular CoQ10 into ubiquinol. So it's not going to do anything for your energy, your heart, or your fatigue unless you make the conversion, and for your other muscles. When you're in your 50s, that accelerates at a rate of about 2% per year loss in the ability to convert CoQ10 into ubiquinol. So now by the time you're 59, you've lost 30% of your ubiquinol. That can make a difference. So when I was about 55, Kanika, which is a Japanese company that's famous for their CoQ10, it's been used in many hundreds of human clinical trials, they came out with ubiquinol for the first time. And it's the only CoQ10 made in America. It's the only natural CoQ10. It's made by a fermentation process. It's the only antioxidant version. It's the only body-ready bioidentical version. It's the same as the one you make in your body. By the way, another group of people that have trouble creating ubiquinol is every diabetic. Diabetes is not just a disease of sugar, it's metabolism in general, including triglycerides and cholesterol and energy. And when you give diabetics ubiquinol, it's excellent for them and it's excellent for their heart. So here's a study called the Q-Symbio study. And these people are already on drugs for their heart failure. Most of them had heart attacks. That's what caused their heart failure. It's 420 people. So the idea is to raise their ubiquinol level. So after 2 years, raising ubiquinol levels, it cut down on additional heart attacks by 40%. It cut down on heart-related hospitalizations by 50%, but it cut down on mortality related to the heart by an additional 50%, above and beyond the standard drugs they use for heart failure. Now, those drugs already keep you alive, but adding ubiquinol further cut down on the risk of dying in these people with heart failure, people with damaged hearts, by an additional 50%. That's powerful. So here's the journal Biofactors. It's East Texas Medical Center and also Trinity Mother Frances Hospital in Texas. And it's patients with class 4 heart failure. congestive heart failure, where fluids are building. Their heart is so poor at pumping oxygen-rich blood that everything's backing up in their body. They're getting fluid by their lungs, etc. It's a terrible situation. So it's New York Heart Association Class 4, which could be terminal. I mean, that's a very dangerous situation. When they gave them coenzyme Q10 up to 900 milligrams a day, it wasn't doing that much. It wasn't elevating their blood level to clinically significant levels. So they switched them to ubiquinol, the form of the supplement I love to use. I take it every morning with my breakfast, and I take another one with my lunch. So here's what they found. People who had a mean ejection fraction of 22%, which is very low, that's a dangerous situation. In other words, 78% of the blood was getting left behind in their heart. They were only pumping 22% of their blood. Giving them 900 milligrams of, in this case it was 450 milligrams of regular CoQ10 every day. That's the average. It was up to 600 milligrams a day. Only raised their blood level of coenzyme Q10 to 1.6 micrograms per milliliter. That's not enough. You want it way above 2. You want it like above 2.5. They changed them to ubiquinol. The amount of CoQ10 in their blood rose dramatically from 1.6 micrograms to 6.5. That's really important. But their ejection fraction improved dramatically just by giving them ubiquinol. Their mean ejection fraction rose from 22 up to 39. Now, there was a big clinical improvement. It was remarkable, actually. It improved from New York Heart Association Class 4 down to New York Heart Association Class 2. In New York Heart Association Class 4, you're sitting on the couch and you're fatigued and it's hard to breathe and you could have palpitations of your heart muscle. It's dangerous. In Class 2, you can actually exercise, but you get a little fatigued and out of breath when you exercise. That's a remarkable improvement. So here's what they said. Ubiquinol has dramatically improved absorption in patients with severe heart failure, and the improvement in plasma CoQ10 levels is correlated with both clinical improvement and improvement in measurements of left ventricular function. So it really meant something. And these people are already on the best drugs, like beta blockers and ACE inhibitors. So here's the journal Biofactors. It's Christian Albrecht University in Kiel, Germany. And they're looking at a marker for chronic heart failure called NT-proBNP. So let me explain what that's all about. When your heart is damaged, you leak out a protein into your blood called NT-proBNP. So the level of NT-proBNP can help judge how bad the heart is damaged. But also, if you see it going down when you're giving a person drugs or ubiquinol, it's a sign that your therapy is actually working. So they use it in both ways. One, to judge how bad the heart's getting, and two, to see how well the drugs and the other products given to these people are doing for them. So they found that, first of all, ubiquinol is found in every cell of the human body. But the highest concentration is in your heart. Now, blood levels of NT-proBNP in people with heart damage indicates how severe the heart damage is. So what they found is the level of NT-proBNP in healthy people was not connected with regular CoQ10 called ubiquinone. It was connected to the level of ubiquinol, active coenzyme Q10. So normally there's a ratio of active to inactive. So a young person might have 70% active ubiquinol to 25% inactive regular CoQ10. But in people with heart failure, it's kind of like just the opposite. And they found that the better the level of ubiquinol in otherwise healthy people, the lower the level of NT-proBNP, meaning their heart was younger and stronger. Then they looked at people who survived a heart attack, and they found that people who survived a heart attack had higher levels of NT-proBNP than healthy people. So healthy people have higher levels of ubiquinol and lower levels of NT-proBNP, whereas people who've had heart damage from a heart attack, lower levels of ubiquinol, higher levels of NT-proBNP. So then they took people and they gave them ubiquinol, and their NT-proBNP levels went down in otherwise healthy older subjects. So there's a lot to ubiquinol and heart health. So here's the University of Gießen, that's over in Germany, the Lancisi Heart Institute in Italy, the Baker Heart and Diabetes Institute in Melbourne, Australia, Swinburne University in Melbourne, Australia. It's in Heart, Lung, and Circulation, that's the journal. And they found that if they added ubiquinol to a statin drug, it further improved the health of people with chronic heart failure. Adding ubiquinol to a statin. Now that's really important. People with heart failure or a heart attack, there's less ubiquinol in their heart, and the heart has it starves for ubiquinol. And by the way, statins like Lipitor, atorvastatin, or Zocor, simvastatin, they also lower your level of ubiquinol. So you've got a double whammy in the heart. The statin drug is lowering the ubiquinol, and the heart attack lowered the level of ubiquinol. Adding ubiquinol to the statins improved the health of heart failure patients already on a statin. And here's the last one. It's in the American Journal of Cardiovascular Drugs. It's the Division of Cardiology, Yokohama City University Medical Center in Japan, but also a whole bunch of other academic research centers. It's a randomized, placebo-controlled human clinical trial. It's a crossover pilot study. Patients with stable heart failure with reduced ejection fraction. The heart isn't beating well. That's the left side heart failure where the heart is not pumping enough blood. They gave them either ubiquinol, 400 milligrams a day, or placebo for 3 months. They took nothing for a month. That's called a washout period. And then they were switched over. The people on placebo now got ubiquinol. The people on ubiquinol now got placebo. And they found no doubt about it that it improved the function of the heart. 3 months of ubiquinol in people with heart failure improved the function of the heart and the blood vessels. So it takes a lot of pressure off the heart. So here's the thing. People with diabetes need ubiquinol. Always take it with food. You're better off taking it earlier in the day because you absorb it better with food, but take it earlier in the day because it also tends to give you energy. Older people need ubiquinol. Anybody with damage to the heart requires ubiquinol. Get a good company. There's 3 Chinese companies. I have no idea what quality their product is or where they make it. And ours is made by Kanika down in Texas. And then we encapsulate it either in New Jersey or in South Carolina, Greenville, South Carolina, depending on what we're doing with it. So thank you for tuning in today to the Invite Health Podcast. You can find all of the episodes for free wherever you listen to podcasts, or just go to invitehealth.com/podcast. Please subscribe and leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. The information on this episode is linked in the episode description, by the way. Now, I hope to see you next time on another episode of the Invite Health Podcast. Thank you so much for listening. And look for another episode, I haven't written it up yet, of the drugs used in people with heart failure, just to give you some information on that if you're interested. And thanks again for listening.